Okay, welcome everyone to Oral Health for All Californians webinar. So we're gonna get started. It's 11:01 right now, and we have 19 attendees. And so, we'll have people trickle in as we move forward. So again, welcome. My name is Mihei Zhang. I work as a Southern California Policy and Outreach Manager at California Pan-Ethnic Health Network, CPEN. And we are hosting the Oral Health webinars, and I will be your facilitator today. This is the very first webinar that we're doing, and it's going to be part of a 4-part series. And together, we're going to explore the topic of oral health in California. Next slide. And so the goal of the webinar series is for us to build some foundational knowledge together on what oral health is and how it's delivered so that we can best serve our communities. And we decided to do this webinar really out of request from our partners. I think a lot of partners, advocates, and community-based organizations felt that they needed more tools to know how to navigate the oral health systems. And since oral health issues and emerging aspect in our community work, that it's really necessary for us to have accurate and consistent knowledge so that we can disseminate the right information that is consistent, clear, and again accurate. So we have 4 webinars. This is the first one. So today we're going to talk about Denti-Cal and what oral health is. But the other 3, I'd like you to stay tuned for those. The second webinar would be on oral health coverage and procedures. Third would be understanding who else can provide oral health services aside from dentists, including mid-level providers or alternative providers. And the 4th webinar would be highlighting some community best practices. So we'll have, or we'll involve other community-based organizations to share more about the work that they do. Next slide. Before I talk about our presenters today, I'm going to do a little bit of housekeeping. This is a learning environment, and our presenters are a resource to you. So please put any questions you have in the chat box, and it's going to be monitored. Don't be afraid to ask questions. Again, we are learning this together, and so we are going to be, we're going to have 15 minutes of Q&A, so please feel free to ask any questions that you have. Our presenters will be presenting for 40 minutes, and then afterwards we're going to do Q&A. You have all joined the webinar in listen-only mode, and you're muted, so please put all your questions in the chat box. This webinar will also be recorded. Slides, handouts, and everything will be sent out tomorrow. Okay, great. So as far as our presenters, we have 2 excellent advocates that are amazing and that have worked in the field of oral health for several years. They have so much to offer, and we're really grateful that they're with us today. We have Amber Christ, and she's, has worked over 10 years in the field of legal services and advocacy. She's an attorney. She's joined Justice and Aging's healthcare team in February 2013 and is based in LA. Amber works on healthcare programs impacting low-income older adults and leads Justice and Aging's California Oral Health Advocacy. So she'll be providing more of that older adults perspective. She's admitted to the California, Missouri, and Illinois bars and is a 2006 graduate of Washington University School of Law. So thank you, Amber. And we have Fatima Morales, and she joined Children Now in 2013 and helped launch the Cover Till 26 statewide outreach and enrollment campaign, promoting Medi-Cal coverage up to age 26 for current and former foster youth. Currently, Fatima supports Children Now's health and oral health projects with policy analysis, research, and outreach support. In 2017, she joined the Oral Health 2020 Network Support Team. This is like a national coalition as a network relationships manager. Fatima holds MSW from the University of Washington, yay, my school that I graduated, and a BS in psychology from the University of Southern California. So we're so lucky to have 2 really great advocates with us, and I will turn it over to Amber and Fatima. Thank you. Next slide.
Thank you so much, Mihei, and the whole team at CPEN and everyone who's on today's call. Amber and I are really happy to be with you all to share all the great news and information about oral health coverage for Californians. So I'm just going to quickly start off by going over a brief overview of the agenda for today. So um, we'll sort of go into four distinct areas of today's presentation. First, we'll start off by just getting grounded in why oral health matters. That's really important when, sort of engaging in this discussion, is first having a shared understanding of why this issue is even important for our communities and for Californians. Then we'll jump into an overview of coverage options. So how do Californians access dental services in California, whether they're children or adults, and then what different sort of coverage and benefits are covered under available coverage options. We'll move, after going over coverage, we'll move into sort of what consumers and organizations that are working with families and children, how people can take action, or how can consumers report issues with their dental coverage. So going over the appeals and grievances procedure and sort of actions consumers can take to make sure that they're getting the services that they're entitled to. And then we'll close it out with sharing of resources and other options that are available to folks in our state to access dental services. We'll go over what's available, but as we'll cover, not everyone has an access point currently, so we'll talk about other ways people can get access to services, and then we'll open it up for discussion. But as Mihei mentioned, please feel free to chat questions, ask questions, jot them down, so we can make sure we answer any questions you have as we go, or definitely at the end of each section. Next slide, please. Okay, so we'll start off with why is health or oral health important to overall health? Well, for someone like myself who's been working in health for quite some time, to me, the link was really visible, both personally and just in my work. It's so clear to me that oral health and overall health are linked, and I'll talk a little bit more about that in a second. But essentially, our mouths are the gateways to our bodies, and whether we realize it or not, a lot of what happens in our mouths can impact our overall health, and also our environment impacts actually what we have going on in our mouth and what happens to our bodies. So, in the end, really, if we have healthy mouths, then we'll have healthier bodies, we'll have healthier families and communities, and that all just translates into a stronger community overall, that's free of disease, and that doesn't have to suffer through any burdens related to preventable conditions or preventable complications. So diving in a little bit more, next slide, into the connection. Oh, and I'm sorry, this is a little smaller on the screen that you all are seeing, but I'll read a few of these examples out, but you will have slides after the recording of this presentation. But so how is sort of oral health connected to many very varied aspects of our lives? One, through there's a mental health connection. If you think about when you've had a serious pain or an injury, it can be quite hard to focus on school, work, at just daily activities if you are suffering through pain. And so, when individuals don't have access to oral health care services or a provider in their community, they could suffer from untreated pain or decay. And so that can impact their daily functioning, but that could also impact someone's self-esteem. I know people in my own family who, a smile is very, it's a marker of some, aesthetic. And we are a culture that, values aesthetics and that looks at aesthetics. And so when you think about individuals who might have untreated conditions or need access to dental care, that could impact someone's even perception of themselves, or even how they're received in our society. So something as simple as, your access to our healthcare services can impact your mental health. When thinking about babies, babies when they're born are their bodies are developing, and so they do pick up bacteria from their surroundings that helps build their immune system. But at the same time, if harmful bacteria like oral diseases is introduced to children, that could impact their development and their oral health. And so again, you can see how the health of the family actually impacts different people within the family, depending on, whether they have access to oral health care services or providers in the community. Some other links to sort of oral health and the immune system and just medicine and different health conditions. There's definitely a link between dental disease and bacteria that can form in the body that can get into the bloodstream and can spread to the heart. So your heart health can be tied to your mouth and your oral health. Individuals who have been diagnosed with diabetes, they have issues that are related to their condition that require particular treatments or that just require special care. When thinking about sort of the oral health of different people, we really we really need to embrace an equity approach and a targeted justice approach, which pretty much means that it's not always a one solution for everyone, a Band-Aid solution, but really it means that in order to get to optimal oral health for all, we need to think about different things for different people and advance solutions that promote the health of different communities based on whatever their issues are. And I really sort of, in sort of talking through the diagram that's on the screen, we've talked about mental health, medicine, the immune system, babies, different chronic conditions that can have an impact or interaction with oral health. But that's all medical, right? There's also everything beyond what's in our bodies and in our medicines and the available through the treatment that we get. There's also the whole we have to, if we take a broader view, we can think about how access to healthy food impacts communities. Some communities don't have the same access to healthy foods and nutritious foods as other communities. We know that food deserts are a real thing. And when we think about school policies and sort of what beverages are available in schools and in our communities, again, you can see that all of those minor decisions that we make throughout our day really all come back to our oral health, which really does affect our overall health. Next slide, please. And so we really, we wanted to start off today's webinar and today's discussion by grounding ourselves in it's all connected, right? It really is. And it's important to see that it's all connected, or we hope that you all see more clearly the connections between oral health and overall health and community health, because at the end of the day, today's webinar and the work that Amber and I do is really focused on making sure that we get to equitable and quality access to oral health care for all Californians and really all Americans at the end of the day. And the reason that we think it's important to get to oral health for all is because to date, one way to think about how different people experience or access oral health care services is sort of to think of different doors and keys. So a lot of individuals today still struggle with face a locked door when they're thinking about getting to oral health services. So the locked door might be it's not a covered benefit. In Medicare, that's a large program that serves a lot of Americans, a lot of Californians. Dental is limited, and Amber will talk about this later, so I won't get into specifics, but that's an access issue for adults. That's a locked door. What is the key? What is the key that we can use to unlock that door is we can work together across our nation and in our communities to make more services or to expand and ensure that dental services, oral health services are covered in programs like Medicare. The restoration of adult dental benefits in California that we'll talk about later today is precisely a key that California created to unlock the door that was keeping a lot of adults out of accessing oral health care services. And similarly, whenever action is taken at the federal level or even within our state to improve systems to make it easier for families to access dental care. Those are all keys that are helping unlock all the barriers that we're seeing in our communities. On the screen, some of the barriers that have been identified. This is a graphic that's used by the national network that Mihai mentioned. Some keys that really get us to good oral health for all are things like fluoridated water, dental sealants for children. This helps make sure or prevent cavities or reduce the risk of cavities in kids, and they're underutilized. That's another key that we can use and really equip families with, so that they, don't get locked out of good oral health in their family or in their community. But just that, I hope that metaphor, or we hope that metaphor is helpful in thinking about, even the different doors that people might be locked out of. It could be access to healthy food, access to, fluoridated water, and insurance. All those doors could be locked. So as we sort of go through today's discussion, we hope that you keep this keys and doors metaphor in mind, because we're hoping that you all will work with us to identify the keys that help remove locked doors for people that are preventing them from accessing or achieving optimal oral health. And we're hoping that you'll help us open some of those doors and work with us to unlock some of those doors, and educate people that the doors even exist. But we'll get into more of these different pieces later on today's call. Next slide. Okay, so we know that oral health is important to overall health, and there are locked doors and some keys that Californians have to break through barriers that keep them out or prevent them from having optimal oral health. So what do we know today? What is some data that we can look at that tells us a little bit about sort of what Californians are dealing with in terms of access to or the incidence of oral health care issues? So on the left-hand side of the screen, you'll see that both of these charts come from the state oral health, the state of the burden of oral health. I forget the state oral health program report that was released. It's our state Department of Public Health agency just released a report about the oral health of Californians. I'm forgetting the name of it, but these two graphs come from there. And essentially, what I'd like you to take away on the right-hand side of the screen is a map of California's various counties, and what it highlights is the prevalence, or how many pregnant women had a dental visit during pregnancy, with the yellow being areas where there was a lower prevalence of women going to the dentist during pregnancy, and then the dark blue areas being areas where people had higher than average visits to the dentist. And as you can see, there's geographic differences in women's access to dental care during pregnancy, which could impact their pregnancy and their own health. And on the left-hand side, you'll see that there's information or data graphs about the oral health of kindergartners and third graders in California. It's a couple of years old, but it does provide, again, a takeaway here is that there's a high history of decay amongst kids, despite the fact that the majority of kids in California have dental coverage through programs like Covered California or Medi-Cal, and there are racial and ethnic disparities within that. So there's a high incidence of decay, there's a high incidence of untreated decay, and then there's actual, what you see as the outcome of that is the use of urgent dental care because of access issues. Next slide. And then looking at adult dental utilization, we also see that dental utilization by adults is also lacking, or that there's area for improvement for us to ensure that adults are getting to the dentist, with rates averaging between 20% for an annual dental visit, and then preventive services having an even lower utilization rate of only 12%, dental exams 16%. As you can see, we can hopefully really increase these rates by doing all our part to make sure that people know about dental benefits, know how to use them, but that also any barriers that people are experiencing are removed. And we'll talk more about that in the next section of this presentation. Next slide, because I'll hand it over to Amber, and she's now going to dive into coverage options that are available to Californians.
Thanks, Fatima. So as Fatima mentioned, I'm going to be covering the different types of health insurance coverage options that are available to low-income adults and children. Next slide, please. To get us started, I just wanted to make sure that we were all on the same page with regard to common definitions and terms that I'm going to be using during the presentation. So the first is Medicare, which is the primary health insurance coverage for older adults age 65 and over and individuals with a disability that has had that disability for 2 years. It's a federal program. Medicare Advantage is a health plan type that you can join as a Medicare recipient that offer benefits that original Medicare may not cover. So for example, a lot of Medicare Advantage plans may provide some supplemental dental coverage or vision or gym memberships, things like that. And then we have Medi-Cal, which is California's state Medicaid program that offers health insurance coverage for low-income individuals that have both low income and resources. And then we have dual eligibles, or who are often referred to as Medi-Medis. These are individuals who are eligible for both Medicare and Medi-Cal coverage. And then finally, we have Covered California, which is California's health insurance marketplace that provides health insurance coverage to individuals, families, and small businesses who often, or the majority of, who receive subsidies to help make that health insurance coverage more affordable. Next slide, please. So if we start with Medicare, unfortunately, Medicare, although it is the primary health insurance coverage for all older adults and many, many individuals with disabilities, does not include a dental benefit. So it's not going to cover cleanings or fillings or tooth extractions, root canals, dentures, anything that you would consider to be dental treatment. There are very small exceptions to this rule in which Medicare will pay for procedures that are part of a covered procedure and also for an oral exam before a kidney transplant or a valve replacement, but then Medicare is not going to actually pay for the treatment. So this is a very big gap in oral health coverage for Medicare recipients. And we'll talk a little bit about this later, but as Fatima mentioned, one of the keys that you can use to unlock a coverage option would be to include a dental benefit within the Medicare package. So there is advocacy happening right now federally to try to make that happen, but right now it is not a covered benefit under Medicare. So that takes us to the next slide and to California's primary way of covering individuals for oral health coverage that are low income, and that is our Denti-Cal program. So just to give kind of a high level explanation of Denti-Cal, it's a little confusing because we like to name different things in California just to keep it interesting. So we have our Medi-Cal program, and it delivers the dental benefit through Denti-Cal. So it is a carve out. And what that means is that the dental benefit is not delivered alongside with all of your other Medi-Cal benefits. So for example, if you're in a Medi-Cal health plan, your Medi-Cal health plan is not giving you your dental benefits. Denti-Cal will be giving you your benefits. It also is carved out in the sense that it's really administered at the administrative level separately. So you have the Department of Healthcare Services who runs our Medi-Cal program, and they've kind of split out like staffing of who oversees the Medi-Cal side versus with the medical benefits versus the Denti-Cal side. In fact, the Denti-Cal office isn't even located with all of the other DHCS employees. So there's a lot of separation between the programs. In terms of the way that the benefit is actually delivered, although most Californians now who are on Medi-Cal receive their Medi-Cal benefit through a managed care plan, dental is mostly delivered through the fee-for-service system. So that means that you can go see any provider that accepts Denti-Cal. There are two exceptions to that. If you live in Sacramento County, you actually have to join a Denti-Cal plan. And if you're in Los Angeles County, you have the option to join a Denti-Cal plan. And the three Denti-Cal plans that are available in both of those counties are Access, HealthNet, and Liberty Health Plan. So again, those are just the only two counties that have managed care for dental are Sacramento and Los Angeles County. In all other counties, the benefit is delivered through fee-for-service. In terms of benefits, for adults, benefits were completely taken away in 2009 because it is an optional benefit under the Medicaid program. So when states face a fiscal crisis, they often try to eliminate dental benefits and are successful in doing that. And that happened here in California in 2009. We were successful in getting them partially restored in May 2014. And then we all had a huge win as of January 1st, 2018, when all adult dental benefits were restored. In terms of residents of nursing facilities or intermediate care facilities, their benefits never went away. They had access to comprehensive coverage even when benefits for other adults went away in the community in 2009. And then children have a different scope of coverage, which Fatima is going to cover. Next slide. Just quickly, the Denti-Cal benefits available to adults include an exam and a cleaning. It is important to note under the Denti-Cal program that dental benefits are not entirely comprehensive. While we got full restoration, they're still they're not fully comprehensive. And even though a benefit may be covered, they are oftentimes very limited in scope and type, meaning that they're only available every few years or once a year, or they will only cover a certain type of service. So for example, you can't get a porcelain crown covered, you can only get stainless steel and resin. So there are these limitations to the benefit package. But generally speaking, the benefit package at this point is fairly comprehensive. You have x-rays and crowns, you have root canals covered, you have full dentures, and all of the federally required adult services, which are FRADs. That's any dental service that could be provided by a medical doctor. And then we had all of the benefits that were taken away in 2009 fully restored. So now we also have gum treatment. We now have root canal coverage on the back teeth, not just the front teeth. We have coverage for partial dentures now, not just full dentures. There's some limitations on lab processed crowns, but they are available for people with bridges. And we continue to have no coverage for adults for implants or orthodontic services. Next slide. There is a coverage cap, but we like to call it a soft cap of $1,800 annually. We call it a soft cap because the provider, if the service is medically necessary, they can ask permission to provide a service beyond the $1,800 cap. It is also up to the provider to first check whether the dental cap has been met prior to rendering services so that the beneficiary is not responsible for checking that or keeping track of that. That is up to the provider to check if there's a balance. Next slide. There are exceptions to the coverage cap. So while it's $1,800, the big cost items don't actually count towards the cap, including emergency dental services, the FRADs, and most importantly, dentures, because dentures they're more costly than the cap itself. So these are exceptions to that coverage cap. Also, any services that are rendered in a long-term care facility for nursing facility residents also are not covered under that cap. Next slide. I'm going to turn it over to Fatima now to highlight the distinctions between coverage for adults and children.
Thanks, Amber. Okay, so the graphic that you see on your screen is actually an outreach flyer that I would recommend you access, share after this call. I think it's a really simple flyer that helps explain what dental services are available for children in California. That was put together by the Children's Partnership. And it's available online for download and dissemination. But so sort of adding, so I guess one way to think about children's dental coverage is that pretty much everything is covered for children in California through Covered California and Medi-Cal. So like I mentioned at the beginning of this call, we have a tremendous opportunity in thinking about how to ensure that kids in California get the dental services to which they're entitled, because 6 million children in California actually rely on Medi-Cal to get their dental benefits, and it includes all of the services, preventive services that you see on the screen, x-rays, exams, fillings. Unlike what Amber said for adults, for their, there isn't coverage for orthodontic services, that is a covered benefit for kids as long as it's deemed medically necessary. And so if a child needs a service, largely it should be covered and available to them, especially within Medi-Cal. And like Amber mentioned, the way children access dental services through Medi-Cal varies depending on the county that they live in. With covered California, and with Medi-Cal, it's not, so if they're in LA County or in Sacramento, they might have a dental managed care plan. If they're in LA County or anywhere else in the state, they might have just straight Medi-Cal fee-for-service. And so beneficiaries can just call a dentist and make an appointment with a dentist who accepts Medi-Cal, or use one of the dentists contracted through their dental managed care plan. Under covered California, it works a bit differently in that the dental plan is embedded within the health plan that the family selects for the child. And so that's already included as part of the medical plan that the family selects for the child. So it's not a separate system or a sort of separate card. It's all in one, or actually it might be a separate card. I don't know that specific point, but it's all embedded within the same coverage. So when families sign up, it's all through one. Next slide. One important thing to draw out, which is like Amber mentioned, adults do have caps or certain services that aren't covered for and might have a cap for services. For kids, there is no yearly limit or cap because of ideally, if a child needs a service that's not covered, but it's identified as medically necessary, there's protections for children through the early periodic screening, treatment, and diagnostic program. You might have heard of this as the acronym EPSDT, but essentially this ensures that children receive comprehensive preventive diagnostic and treatment services to identify any issues that could be that they might need health services for. So the idea is prevention. We don't want to have a costly condition or a condition that really impedes a child's long-term development and quality of life. And so EPSDT ensures that children, if they need a service, are entitled to it. Like Amber mentioned, for adults, there might be limits on how many times someone can access a service within a year or even within a couple of years. That should not be the issue for kids because of the EPSDT program and protection. Really, kids should get the services that they need based on whatever their needs are. It shouldn't really be subject to caps. So, you know, when we talk about when Amber talks about appeals and grievances later, if there are issues with families getting services that they need beyond what's currently covered by Medi-Cal, those are places where we would really love to make sure that we connect families to advocates who can help or who to use the complaint line. Next slide. But despite all that, there are still co-payments in Denti-Cal, which is the same as Medi-Cal, and it applies to both children and adults. So for non-emergency services provided in an emergency room, there's a $5 copay. And then for prescription drugs and outpatient services, it's $1 with the exception that nursing facility residents are not subject to copays. One other thing that I wanted to say that just came to mind in talking about all this is a distinction between the child and adult. Just thinking about us engaging and making sure that we protect coverage that's currently available. For children, dental coverage is a required benefit under federal Medicaid guidelines. For adults, it's an optional benefit. So we just restored it and we want to make sure we keep it. That's just a protection to keep in mind. And California has even gone above and beyond the federal guidelines in that California actually provides coverage to undocumented kids. And so undocumented kids up to the age of 18 actually also can access dental benefits through the Medi-Cal program. So just some distinctions and sort of thinking about where California has gone above and beyond and where we need to make sure we maintain those coverage expansions. So with that, I'll hand it back over to Amber.
Great. Next slide. So just a little bit more on Denti-Cal. We see often on the ground that individuals are being billed for services I think it should always be a red flag if a Medi-Cal beneficiary, whether they also have Medicare or if they're a kid with Medi-Cal, is being billed for a service. It should just raise a red flag and is worth investigating whether that charge is actually valid. Because what we find, particularly in the Denti-Cal world, is that a lot of people get charged for Denti-Cal covered services. And while providers are prohibited from billing for Denti-Cal covered services, it still happens for a lot of different reasons. But we want to make sure that everybody knows that individuals should not be being charged for Denti-Cal covered services. And they can't bill for denied services other than those services that are denied for not being a benefit of the program. It's also really important as advocates that if you have someone who has been told that they need something beyond what Denti-Cal covers, that they're provided that in writing and that they really understand the repercussions of that because that can often lead to taking out of credit cards or other payment arrangements that are not so great for the individual. And it is possible that the benefits that they're being told that they need, they may not actually need them or may not need the type of benefit that's being offered. So it's just important to check in with the dental provider to make sure that there isn't a Denti-Cal covered service that could be substituted. Next slide. So with that, I just want to highlight some of the issues we see with Denti-Cal. Of course, we see issues because it is a carve-out, not just in the administration of the program, but it also causes issues because it's not integrated with the medical care. And we know that that's a problem because oral health issues impact medical issues and medical issues impact oral health. And so the fact that it's carved out, not just from a delivery of the benefit standpoint, but also from integration within medical care is a big problem. We also know that there is a lack of Denti-Cal providers, and there's a bunch of reasons for that. Previously, the application process was super burdensome. It has gotten much better. Reimbursement rates have historically been very, very low, but with some advocacy where those provider rates have increased somewhat. I think the biggest burden still, though, for providers wanting to participate in the program is just how administratively burdensome the program is. It is difficult to get treatments authorized. It is difficult to get payments submitted and then reimbursed. There's just a lot of obstacles within the Denti-Cal program that make providers not want to participate in the program. So those are all areas of advocacy that we want to be engaging in to make the program more attractive to dental providers, because we know that with such a lack of providers that there's just not access to the benefits. It's also, Denti-Cal has incomprehensive and confusing covered benefits. It's not necessarily intuitive. And so a lot of that does lead to that billing for covered services or trying to upsell people on benefits that they don't actually need. And then that spirals into taking out credit cards that are often very predatory in nature. So it's important, if you have someone that you're helping, that if they have taken out one of these dental care cards, that they really connect with a legal advocate, because there are defenses to having to pay that debt that are worth considering prior to paying that off, because they can be very, very costly for low-income individuals. All right, take it to the next slide. And I'm going to just shortly cover appeals just to make sure that we understand the appeal routes for Denti-Cal. Next slide. So when an individual goes to a dental provider to get services, most services require the dental provider to submit a treatment authorization request, or TAR, in order to render that service. So they submit a TAR, and then they either receive approval to move forward, or that service is denied. So when that service is denied, the provider receives what is called a notice of authorization, either letting them know that it's been approved or denied. So they get the notice of authorization. And then if it's denied, the beneficiary gets a notice of action. So Denti-Cal will send a notice to the beneficiary or the authorized rep for the beneficiary when the service has been denied. Since most of Denti-Cal is delivered through fee-for-service, if an individual has been denied a service, they can go straight to a state fair hearing. If they're in a dental managed care plan, they actually have to appeal with the plan first, and then all the normal appeal triggers take effect that happen in this mirrors the Medi-Cal appeals process. So it's no different in Denti-Cal than it is in Medi-Cal for appealing. It is really important, though, if individuals are not receiving notices of action when something is denied, and they're instead just relying on the provider to tell them that something's been denied, they should contact an advocate, because no matter what, they should receive a notice of action. They should not have to rely on the provider to learn whether they've been granted a service or denied a service. They are entitled to their own notice of action that triggers due process rights. Next slide. For anything other than a coverage determination, you can file a complaint either with the Denti-Cal managed care plan or with Denti-Cal if you're just in regular fee-for-service Denti-Cal. I think it is incredibly important for individuals to file grievances to Denti-Cal when they have a problem with anything with the Denti-Cal program. If they feel like they have been improperly billed by a provider, it can be for the quality of care that they've received from the provider, anything that they're having an issue with the Denti-Cal program. If they can't find a provider, they should file a grievance. We want to make sure that Denti-Cal is actually hearing how many problems people are experiencing accessing the Denti-Cal program. Otherwise, there's no record of all of the things we're hearing on the ground, and we know that there are serious access issues going on. So in terms of filing a grievance, you can go to your provider and try to resolve it if it's a provider-based issue, but it's not mandatory to have to do that. Instead, you can file a complaint directly to Denti-Cal. The complaint form, the beneficiary complaint form, is available. Actually, it is linked to under the resources section on the webinar platform here. There's PDFs on the side that you can access. It is also available online, or you can call the beneficiary complaint, I think it's the beneficiary member services line with Denti-Cal, which the phone number is listed there, and they will take the complaint on the form for you. They must acknowledge written complaint within 5 days. They must inform a conclusion within 30 days. And if the individual is still unsatisfied, they have the right to file a hearing, and it goes up through the normal appeals processes. And with that, I'm going to turn it back to Fatima. Oh, actually, I think I have, no, it's still me. Next slide. And then I'm going to just provide you with a brief explanation of some resources that are available. Next slide. So first, there's the beneficiary pamphlet that explains the restoration of benefits that happen and other rights with regard to the Denti-Cal program. They are available in English and Spanish, and actually I think they're now available in all the threshold languages, and I've put the website there. This is a super handy pamphlet just explaining how to access Denti-Cal and what benefits people have at a very high level, and then healthcare rights. And then the next slide. And then there's some other Denti-Cal resources that are pretty good. The Beneficiary Handbook, which is available on the Denti-Cal website, it now says, this is actually an outdated graphic. It is now the 2018 Beneficiary Handbook is up there. I do recommend taking a look at it. It is also linked to on the GoToWebinar platform here. There was a notice that went out to all Denti-Cal beneficiaries who informing them of what benefits were restored on January 1st, 2018. The biggest resource available in the Denti-Cal program is actually the provider handbook. It has all of the explanations of everything that's covered, limitations to benefits, what needs to be submitted in order to get a covered benefit. It is a very large resource, and it is the most comprehensive in terms of what you want to know about the Denti-Cal program. And then providers also receive on a monthly and sometimes more than monthly basis bulletins from the Denti-Cal program on different updates to the program or things that providers need to know through the program. And now with that, I'm going to turn it over to Fatima. There's one more resource, and I forgot to do the poll. I'm sorry, all. Maybe we do it now. Next slide real quick. There's that beneficiary complaint form that we talked about that people can file a grievance with. And then Mihei, do you want to do the poll about Denti-Cal?
I need my mouse.
We do, really quick.
Okay. I apologize. Breezed right past it.
All right, so
So,
we're gonna.
yeah.
Oh, go ahead.
No, go ahead, Mihei.
Oh, okay. So we're gonna just do a fun little poll. So we want to ask a question to you. How familiar are you with Denti-Cal? And at this point, you all should be experts. But we just want to get a sense of, how comfortable you feel with Denti-Cal. So go ahead and vote. All right, so 79% voted, and it looks like we're going to close it now, and the results are a little bit. So there's very familiar, a little familiar, not very familiar, not at all, and majority of the folks are feeling a little bit familiar with Denti-Cal. So that's great.
This is Amber again. Before I turn it over to Fatima, I do want to mention that we are coming out with a oral health Denti-Cal advocates guide. It is for adults, but so much of it will be applicable to all populations. We hope to have that released by the middle of June, and so we'll ensure that everybody who's on this webinar will receive it. It doesn't just include Denti-Cal, though. By far, it is the largest part of the resource guide. It does cover Denti-Cal, since that is the major coverage option for low-income adults here in California. So hopefully that resource can also help with an understanding of the Denti-Cal program moving forward. And now I'll turn it over to Fatima.
Awesome. Thanks, Amber. So I am going to breeze by the last few slides because I know we want to open it up for Q&A. So next slide. Next slide. Okay, so, we covered a lot around dental coverage, whether it's for kids and adults that are covered in California, and then Denti-Cal, the biggest player, and all the dental managed coverage options under that. But we know that that still doesn't meet the need, and that not everyone is captured through each of those buckets of services or coverage options. And so what is available now, we're just going to transition and switch gears to what other resources are available if you can't access coverage through Denti-Cal or services through Denti-Cal, and if you aren't able to access it through Covered California. First is federally qualified health centers, also known as community clinics. FQHCs and community clinics are a primary access point for low-income and underserved communities in our state and across the nation. And so definitely utilizing FQHCs, and it's particularly FQHCs that have dental clinics associated or co-located. Those really are able to provide a more extensive services or just treatment, but most FQHCs will provide some medical primary care and preventive dental services. So it's an option for individuals who aren't able to access services otherwise. Next slide. Amber's on this call, so if you have questions, make sure to chat them in, but also Medigap or standalone dental plans. That's obviously also a choice. It's out of pocket though. I don't know about Medigap, but standalone dental plans, you'd have to really make sure you compare the plans, the costs, the benefits, all of that, because that really is a consumer driven access point. Though a resource that folks can rely on are HICAP counselors. That's Health Insurance Consumer Assistance Program counselors. These are counselors that are available in every county that can help consumers navigate their coverage options, whether it's through Medigap plans or through other plans. So definitely that's a resource for adults in our communities. Next slide. Next slide. There's also dental schools. So we have 3 dental schools in our state, and usually dental schools might provide services to individuals on like a sliding scale. Some also accept insurance. There might be, this is another avenue to explore. Sometimes there are wait lists, but it's an access point, or it's one area to get services. Next slide. You all might also have heard of these. If you live in LA County, you might know it as Care Harbor, but it's essentially another way people can get services is through just free pop-up clinics. Sometimes there are these huge clinics that pop up where volunteer dentists come out and provide free services to families and community members, and they can be crowded. There might be a ticketing system or something where you have to get a ticket before you can just show up and get services, but that's something to look out for is free pop-up clinics. I think CDA Cares events, that's another sort of key name to look out. Next slide. So those are just all resources that are available outside of what you can access through Denti-Cal through other coverage options. And now we want to bring it back to advocacy. I think at different points throughout this whole presentation, we've talked about things that we've been able to restore, get back. So the restoration of adult dental benefits, that was an advocacy effort over a number of years that we're happy to see that now those benefits are restored, but there's more work to be done to ensure that people are able to use them. Increasing Denti-Cal reimbursement rates has been an advocacy push and something that we've had success in, and we want to make sure we continue to monitor and inform. Recently approved Prop 56 funding has now made funding to counties available, or it's something that now counties can rely on to improve oral health. So counties will be developing or they'll be developing local oral health programs as part of the state oral health program. But that was also released by our state dental director as a state oral health plan as a way for us to get to oral health for all Californians. We have a California Oral Health Network that's been created, and that is growing. So if you care about oral health, just want to learn more about oral health, join the California Oral Health Network to get updates, to get resources, to get information. At the national level, there's advocacy to make that Medicare dental benefit a reality. And, so we're making strides in that way at the national level that folks can plug in and get involved in. And then two things that are also sort of efforts that we're monitoring that we're always making sure to improve is one is the kindergarten oral health assessment. There was legislation last year to make sure that kids enter kindergarten or first grade with a dental visit. If we're thinking about prevention and early identification, this is one key way to make sure that we're reaching kids as early as possible. Medical and dental integration is another sort of advocacy or an effort that's being pushed more broadly, generally within the fields. Again, that idea that medical and dental shouldn't be segregated, that hopefully there's a whole team on both sides, comprised of both sides of the health system that work together to ensure the patient's oral health needs are met, and that is factored into any sort of health conversations or decision making. Next slide. And that's just more on the kindergarten oral health assessment that I think I covered previously. Next slide. And here are a few more resources, the guide that Amber mentioned, and just our contact info, a ton of resources for you to review, even the state oral health plan that I mentioned from the Department of Public Health, how to sign up for the California Oral Health Network, and then just different resources that that you can use. And how you can get in touch with Amber and I is at the bottom, along with how you can follow us on social media to get all the breaking news about resources and just policy developments. And I think with that, we have 6 minutes for Q&A. So I'll hand it back to me, for the last piece.
Thank you, Fatima and Amber, for the great presentation. We do have 5 minutes, but if folks can stay a little bit past 11, that would be great, so that we can get some questions answered. And so one question we have here is regarding adult coverage, soft cap, 1,800 is annually. So regarding that piece of information, the question is, what happens if the cap is reached for those who need additional services and have financial hardship?
Sure, this is Amber. So the cap is soft. So as long as the service is medically necessary, people can get those services if they've already met the cap. So there shouldn't be a circumstance where even financial hardship needs to come in. It would have to be an uncovered service or not medically necessary, at which time it wouldn't be approved by Denti-Cal anyway. So the 1,800 cap is really, it's really just a limitation in theory, I think. Not to mention that it is rare because of the exceptions for people to meet the $1,800 cap, just because the reimbursement rates here in California for covered services is so low. You would have to need a very extensive amount of oral health treatment in order to reach that cap. Not to say that that doesn't happen from time to time, but I think it's pretty rare. And then if you do need to go above the cap, your dental provider can ask permission to do so as long as it's medically necessary service.
Mm-hmm. So basically, folks can get the services that they need.
Yes, as long as they're covered by Denti-Cal. And keep in mind that there are great limitations in the Denti-Cal program. The fact that you can't get a porcelain crown is a pretty big one. If you lose your dentures and you don't get a new pair usually for 5 years, there's a 5-year limitation on that benefit, unless you can prove that they were stolen or damaged in like a fire, and you have to have a police or fire report. So there are great limitations to the Denti-Cal benefits in that way.
Gotcha. Thank you, Amber. And the next question we have is, who do we contact if a child with Denti-Cal was told that a specific service is not medically necessary and therefore Denti-Cal will not pay for it?
I would say that I would use the complaint and grievance form, honestly. Amber, I don't know if you could share thoughts, but I think essentially if it's a covered benefit and a provider, I don't know if you would could find a different provider, but ideally I would submit that. Or is that something that would be good to submit through the complaint process, Amber? Do you think?
I think there's a couple routes. I think the first thing, I would probably submit an appeal and argue, especially if your provider is willing to work with you, arguing that it is medically necessary. I think there are probably circumstances where dental providers try to get reimbursement for something that's not medically necessary, but I kind of think that that's rare. So I think if the provider, that I would submit an appeal and argue that it's medically necessary, particularly if you have the support of the dental provider. It might be best to employ an advocate in that. So the Health Consumer Alliance is a really good resource for helping with dental appeals. They've been doing a lot of oral health work, as have Advancing Justice. Asian Americans Advancing Justice can help with oral health appeals or Denti-Cal appeals. So I would rely on them. If you just type in Health Consumer Alliance into your Google search bar, you're going to get their statewide phone number, and then wherever you are, it will direct you to the legal services office in that county that can assist. Because I do think it's difficult to navigate these appeals sometimes, but I do think it's worth appealing if you think it's medically necessary. There is the right to get a second opinion, but it sounds like it was denied from Denti-Cal and not because of the provider. So I think the best thing to do is appeal.
Thank you.
Thank you. The third question we have here is, what if we cannot find a dental provider in our county who speaks the language of the parent? Many of our kids speak English and Spanish, but their parents don't. And then the parents leave the appointment not understanding the direction given by the provider to the parent for care.
Great question. So 2 things that should happen. First of all, you can call the Denti-Cal member services line and ask them to help you find a Denti-Cal provider that speaks that language. As we know, there aren't a lot of Denti-Cal providers. There are particularly not a lot of Denti-Cal providers who speak other than English, languages other than English. So the second option is also to call the Denti-Cal member services line and request an interpreter. The individuals are entitled to an interpreter and to have interpretive services, both in person at actual dental appointments and also any kind of phone correspondence that needs to happen. So it's just a matter of requesting that interpreter before going into the appointment.
Great, and we'll include that resource, the Health Consumer Alliance number and also the Denti-Cal membership line, so folks can access those. And the fourth question we have is, how do I find out which dentist takes Denti-Cal? What if I can't find an appointment near me?
This is Amber again. This is a hard question. Unfortunately, there isn't a Denti-Cal provider directory. Online, there is a list in PDF form by county of providers that have agreed to accept referrals for Denti-Cal. There are many counties that do not have, there's no Denti-Cal provider listed. So if you can't find a Denti-Cal provider, call the Denti-Cal member hotline. They're supposed to help with this. It is very troubling that this is an issue. So I also recommend, other than just calling, if you are having access finding a provider, that you file a grievance with Denti-Cal so that they know that people are not being able to find providers that are willing to accept people. It's one thing to be listed possibly. It's another for them to actually see you and accept you as a patient. And we know that this is a very big problem, particularly in rural regions where there are no providers at all that are accepting Denti-Cal. So it's important for you to call and get assistance, but it's also important to make sure that there's a grievance filed so that there's a formal record of the fact that you can't find a Denti-Cal provider. And then I would suggest, if you still can't get a Denti-Cal provider, which I think that they should be able to connect you with one, but if you still can't, that you rely on some of those other treatment options that Fatima covered. I would start with a community clinic, since they have dentists on site, and you can go to one site to get all medical care, and they accept Denti-Cal as well as sliding scale. So I would suggest that if you cannot by any means find a Denti-Cal provider.
Thank you. And I just want to plug, when Amber talked about in rural areas, there's a, shortage of providers and what they call, provider desert. We have our third webinar that talks about alternative providers and mid-level providers, folks that are able to do some preventative services and how to access those folks and learn about what they do, so that we know what resources we have. So we are almost to the end of the webinar, and the last question is for both Fatima and Amber, and it is, if oral health is equal to overall health, then why do we have separate insurance systems for dental versus medical health? What are the implications of the separation? So we'll just, that would be the last question, and yeah, it's a big question.
I'm so sorry I have to hop off a call, since I'm happy to share my thoughts. So the origins of this division actually date back to sort of the history of how our health systems were created. Oral health just was separate from health since the sort of beginning of, I think, oral health as a profession, I'd say, or that's been my understanding, is that this isn't sort of something that just happened in the last few years. It's just the way in which our understanding of health has evolved in our world and our understanding, similar to how we didn't really think about the brain or the mind and mental health as so important to overall health and well-being. And it's taken us some time. Same with oral health. Making the connections has just it's been an evolving process, I think, for, even though it might have been more evident to others, I think is a larger movement. It's taken some time, but I do think that there are strides that are being made in now integrating these two and seeing the links as new science and research becomes available. The links become more evident and documented. So I think that's that's one of the reasons that these systems are siloed, but why we're working to either align systems or at the very least integrate it to the best extent possible. But Amber, I don't know if you have other thoughts on your end about the division and how we can bridge it.
No, I think you're right. I feel like there's momentum today to try to bridge it, that there's more talk of integration in primary care with oral health. But the implications are really dire for people. And I think that in any way we can advocate for more integration, the better. The health plan of San Mateo, actually up in San Mateo County, is getting permission through this budget year to launch a pilot in which the health plan of San Mateo will actually take over the dental benefit. So it'll be integrated into the health plan, much like how Fatima mentioned in Covered California. That's how it works. So it'll be interesting to see what that looks like in practice, and if it in fact is better as an integrated benefit. I can't imagine it being worse, or I guess it possibly could be the same, but and I think it's going to make things better. And there are things to do to help try to integrate. There is some legislation that's just not being enforced right now. AB 20, I'm not going to remember the bill number right now, but that basically says that like health plans, the Medi-Cal plans are supposed to screen people for oral health needs and then help refer them to dentists. That's not really happening, and if that were happening, that would help improve the integration. But it does have ramifications on people's overall health. For example, if you can't find a dental provider, you're probably going to end up in an emergency room, which is going to lead to other issues and higher costs. But just having to try to navigate your medical needs that are impacted by your oral health issues, or oral health issues impacted by your medical needs, really does negatively impact people and their overall health.
Great. Well, with that, thank you, Amber and Fatima, for your time, and thanks to all our participants for joining us today for the webinar. And together, I hope that we can, keep unlocking these doors so that we can achieve oral health equity in our communities. As I've said before, slides, handouts, all the resources, recording will be sent out so that you have access to them. And, there will be announcements regarding the upcoming webinars. And if you have any questions, you can contact Amber, Fatima, or myself, and we will close the webinar. Thank you, everyone.
Thanks all.
Thank you.